Hi, everybody. It's Allison here from Moms at Work. I have a very special guest today. Marianne is joining us to talk about mental health in the workplace and supports for both ourselves and our employees. And I'm going to have her introduce herself. Hi, Marianne.
Hi, Allison. Thanks a lot for having me here today. And to introduce myself, I've been a working mother. Back in the olden days, you only had 4 months off. And I had 2 boys, 13 and a half months apart. So I feel you. I absolutely know what it is. So that's my biggest qualification. You might also be interested that my field is psychological health and safety and workplace mental health, both for individuals as well as for organizations. And I was the co-chair on the technical committee that created the National Standard of Canada for Psychological Health and Safety in the Workplace. Mm-hmm. And I'm also the Director of Collaboration and Strategy, such a great big title, honestly, for workplace strategies for mental health. So what we do there is create free resources that are available in French and English for anybody. And so today, when you and I are talking, Allison, and I throw out names of things, they're all there, they're all free.
Perfect. And I will provide links below as well so that they can find the website, they can find all the things. And that's exactly why I'm like, a lot of people need free resources right now. Yes. So maybe we can start. Do you have suggestions for HR folks, managers, on things that they can provide their employees? This is an incredibly stressful time and people just don't really know where to look.
Yeah, so there's really 2 streams around that. Is it an employee who is really struggling with their mental health right now? Because in that case, we have a resource called Supporting Employee Success, where you're actually working with the individual to address the particular behavioral, emotional, psychological, practical issues that are getting in the way of performance. So this is not medical. You're not talking about their illness. You're not talking even about their personal issues. You're talking about solutions to deal with what might get in the way of them doing their job. So that's the first resource that I'll talk about, which is specifically for employees who are struggling. But with all of the resources that we talk about, they aren't resources you give to somebody. They're resources that you use to collaborate with them and to engage them in finding solutions that they'll commit to. Because it doesn't really matter what you give them. If they're dealing with excessive stress or mental health issues, they're not at a place to advocate for themselves, to pull themselves up. They need your help. I also wanted to draw attention to the fact that if you Google mental health resources free Canada, you're going to get a plethora of things because so many organizations have stepped up right now to help individuals. WellCan is one of those. And I have a friend right now who is going through their CBT type program, and it's focused on anxiety around COVID.
Okay. Oh, specifically.
Specifically, but all of the skills are transferable, right? There's skills about mindfulness, there's skills about negative thought processes, there's skills about dealing with anxiety. So for your employees who are struggling, there's lots that are available that are credible. And of course, that's the big thing, right? Make sure that what you're sending them to or helping them with is not, I call it the snake oil stuff. And honestly, Allison, if it works for somebody, I don't care if it's snake oil, because most of our healing is in our mind anyways.
Right.
And so that's all right. But as a professional, you can't suggest those things. You must stick to the evidence-based, credible, safe things that you know are going to have a measurable impact.
And I think that's so, my background again is in accommodation. And I think the number one thing that people are scared of, like as an HR person or a manager, is like, which you touched, and I want to touch back on it again, is like, this is, helping to support people in the workplace is not medical. Like, it's not like,
Right.
that's not your role there. And so people get hung up and they don't do anything because they say, well, this is a, this is a medical condition and I can't do that. So maybe walk us through like a quick, they get the resources, they sit down with their employees. Like, are there some parameters that people should do? Are there resources to help an HR person walk through those steps? What do you suggest?
So supporting employee success, the one that I already
Yep.
wrote about, it developed because I do consulting to help people return to work or stay at work. And I basically ask 3 questions.
Okay.
What is it that you need to be able to come to work, do a good job, and leave, well, or not leave, because we're at home now, at the end of the day with some energy left over to deal with the rest of life? And that's specifically asked because I can make you work really hard and get your stuff done. But if you're falling apart with your family, you're going to crash and burn. So it's all about finding the balance and doing it from a strength-based, solution-focused approach rather than, oh, I can see you're struggling. What is it that you can't do now? Which increases victimization, hopelessness, that feeling like I'm not good enough. If we can focus them on their strengths and what they're still able to do, the thing that I've found with people with anxiety or depression, if they're supported to contribute in a productive way, not only does it improve their self-esteem, but it also distracts from those repetitive negative or fearful thoughts that are depression or anxiety. And if you can come and do work, even if it's only for an hour at a time and you need a break, during that hour, if you can escape those negative, fearful, or worrisome thoughts, it's better for you as an individual with a mental illness, and it's better for the employer. So in this resource, oh, sorry, I'll finish those 3 questions. That's the first question. And the 3 questions are like a 3-legged stool. If you miss one, then it's probably going to collapse. So the second question is, what are you going to do differently now to support your own well-being? And the premise behind this, and I don't usually say it to the employee, but the premise behind it is if you keep doing what you've been doing, you're going to keep going in the direction you are going. So you have to change something up. And this came from working with, well, by now, thousands of people with depression and anxiety. And then always talking about the idea that when they start to feel symptoms, that what they do is change things. Well, these are people with clinical conditions. For everybody else, if you're in a miserable mood, if you are not able to focus, if you are feeling down, changing what you're doing is critical to you changing that mood. Now, honestly, Allison, some people change their hairstyle. Some people change the way they drive to work. Some people change what they eat. Some people change their alcohol consumption. The point is, you change things until you start to feel better. So what are you going to do differently helps them get into that mindset that they can't do exactly what they've been doing. So that's the second question. And as with all questions, you follow up with, and what else, until the person says, that's it, that's all. Because then they're at a place where they think, okay, I really think this will help and I can make a change. Last question is, what will we do? What do you want me to do if this doesn't work, or if you're sliding again? How do you want me to approach you so you know I'm supporting you and not just trying to catch you up or harass you or put pressure on you? And I want to help, but I don't know how. So tell me, how do we deal with it? And again, the idea here is you don't want to push them over the edge. You don't want to say or do the wrong thing. You don't want to make it harder for them, but then you just do nothing, right? So If you already have an agreement with the individual about how they want you to react, then what you're doing is setting both of you up for a more effective path forward.
Yep, excellent.
So I think,
Yep.
okay, so that's those 3 questions. Write down what the responses are in specific, measurable, objective terms, and you got your agreement.
Good.
Easy, right?
Yep. Easy. Easy.
Except a lot of people said, no, that's not that easy. Like, you know, yeah, you can talk about all those things, but I don't feel comfortable. And so supporting employee success was working with occupational health professionals and individuals who live and work with mental illness. I always use individuals with the lived experience in order to get a BS check on it, right?
Right.
So that, I mean, yeah, all the professionals can go, oh yeah, it's all blah, blah, blah. But if it doesn't work with somebody who's actually experiencing it, then it's garbage.
Right.
So what we did is we took all of the job expectations. So things like being able to deal with pressure, being able to deal with confrontation, being able to have healthy working relationships, being able to work in isolation, being able to work on a team. And we looked at what does that take from somebody emotionally, psychologically, cognitively, and we rated them as, you know, a really low level of expectation, and then 3 others until you get that that's a big part of their job. The employer or the HR looks and says, this is the expectation we have for your job, and this is how it impacts it. The employee then says, this is the level of capacity I have right now in that area, and this is how I think it'll affect me. And then the third column is for the employee to work with whoever they trust. So maybe it's the HR professional, maybe it's their physician, maybe it's a union rep or a family member. Doesn't really matter, because what we've done is we've put in accommodations that have worked for other individuals dealing with life stressors, mental health issues, physical health issues. And so you're just looking among some options and talking to them about, do you think this will work? And how could it work? Once that's done, so all 3 columns are completed, then it comes back to the employer or the HR professional to sit down and think about what's possible, because not all things are going to be possible in the particular work setting that you have, and then to come up with a plan. So all of this time, you've never talked about the illness. You haven't really even talked about the symptoms. You don't need a doctor involved. You don't need the employer to be touchy-feely, because they're just dealing with work expectations, right? But once you're done, there's other things that this tool has, including how to have the conversation afterwards, what questions and follow-up questions you ask. So it's complex, and yet it's straightforward.
Right.
There's 18 different job expectations. We hope you don't have to use them all.
Yeah.
But you choose the ones that you think are relevant.
Yeah, and it's a good place to start. So here's a tough one that I got asked before this call. Was there is a lot of people who currently are self-employed, feel like they have no resources, don't know what to do with themselves, who may have 1 or 2 employees, and the same sort of issues come up with contractors, right? Because they may be, you know, working part-time for one company and working part-time for another company. What sort of resources, you know, because someone said to me, there are none. And I said, well, I'm pretty sure there are. So what type of resources are available for that situation, not a regular employee situation?
Right. So, and that's what I was saying in the beginning. There's really 2 different streams. So the one stream is for the employees struggling. The other stream is for everybody, because you know what? It is completely normal for every single human being on this planet to have some level of stress and anxiety. We're going through a life-altering pandemic. This is you know, the same life altering that the Spanish flu was, that World War I or World War II is, not to say that we have the same horror that they're going through. But you can bet that everybody who's living through this 10 years from now is going to be talking about their experience. And, you know, just a quick aside, my thinking and the way I'm grounded in the present moment is every day I think, how would I describe to my great grandchildren, if my boys ever have children, but anyways, how would I describe to them how I coped, how I managed, how I reached out to help others, how I reached out to get help from others? And if you think about this every day, think about writing the story that you're going to tell and how you can be the hero of that story, be the one that was able to be resilient, to cope, to get through it, then you're less likely to be worried about what you've lost, which is our freedom, our ability to socialize the way we did. And you're less worried about the future, what's going to happen and how long this is going to last, because you're thinking today, what am I doing today? So that's just a simple aside. But to answer your question about what could you do for the average employee, there's a lot. But one of the resources that we have is called the Plan for Resilience. Not only do we have this really great resource that has been studied by Queen's University and found to immediately have a statistically significant reduction on distress, and immediately have a statistically, that's really hard to say, significant increase in our feeling that we can cope, the feeling that we can do this. But it's got really great activities to help you reflect on, how am I coping now? Which of those strategies are effective and which of those are not so much? What are my automatic physical, emotional, behavioral responses to stress? How can I reach out more effectively? How can I deal with a stressor that I feel I have no control over? And that's important because, again, Allison, this is something else that I just keep saying, and I wish people understood it more effectively, and I know you do, but the quality of our thoughts determines the quality of our life. And if you can spend time managing how you allow negative thoughts to overcome you versus choosing to manage those negative thoughts so that you can allow more realistic, not thinking happy thoughts all the time. That's just ridiculous, because if it's fake, it's not genuine, then you're just BSing yourself all the time, and that's not good for you. But being realistic that, okay, I don't know what's going to happen in this pandemic, but right now I'm healthy. Right now I can look outside and see the sunshine, being able to choose those thoughts. The Plan for Resilience goes through many different ways that you can get through this, not just by surviving it, but by thriving through it. And the good news for the HR professionals that are in your group is not only is that free in English and French, but so is a slide presentation and a facilitator's guide. So you could do it with all of your employees. And you can just do it in parts, right? I wouldn't suggest that, because it's about a 2.5 hour.
Oh, yeah, long.
Yeah, to do the whole thing, and that's too much on a Zoom call. But you can just take them through parts at a time so that you're all doing it. And the thing about it is, it's personal self-reflection.
Yeah.
There's a couple of times where you talk about healthy coping strategies, you talk about your strengths, but you don't have to, and we actually recommend you don't, share those more personal reflections about how you react to stressful situations that maybe aren't so healthy.
Yeah. And so a big concern for a lot of people who are going through mental health issues. Well, first I'm going to say, so let's say I'm an HR person, I am, but let's say I'm an HR person and I say, this sounds great, but I would love to take a course. Psychological health and safety sounds great. Where do I find those types of resources? Where do they find those things?
Yeah, so it depends what your area of interest is.
Okay.
If it's actually understanding the technical aspects of organizational approaches to psychological health and safety, then it's really an occupational health and safety training.
Yeah.
The University of Fredericton has an online course that Dr. Jody Samra created. And it's really good if you want to get into those technical aspects.
Yeah.
If you want to deal with being a leader who can support employees, I'd highly recommend Mindful Leader. There's a certification program that is just started to be online. It was always live. But at the end of it, when you finish that program, you can actually use the designation Mindful Leader Certified. And so that's really great for long-term resume status.
Yeah. Okay.
Yeah. So there's those two things. And then of course, HRPA here in Ontario has lots of different courses too, if you want to get into some of the legal regulatory type issues. Now I want to share with you though, that in what we've done since March, when we went into lockdown and all of my public speaking was canceled, is to create a series of workshops that allow for training about important mental health, but also leadership things. So there's no certification for them, but they're there if you really want to learn with a group of your peers and somebody wants to facilitate, because a lot of them are discussions. Right? Every psychosocial factor now has a workshop for it to discuss each of them.
So is that something that you, like, I know Mandy does things like that, or sorry, I'll talk about Mandy. I just throw her in there. Like, she's
our
like,
friend.
Yeah. So, so I think a lot of organizations like that that's something I've recommended, is that you can do like a several part workshop series and make it available for your employees. So maybe I should
put together. Do them all online.
Yes, and make them available for, especially flexible things like that. So is that something that you are still doing, or is that something that we should go to? Like, who would be the people who you would recommend?
No, so go to workplace. I'm recommending you do it. Like your folks do it, or if they have somebody, it was written that way that you don't have to be an expert to facilitate it, but that you can pick up the facilitator's guide, look through it, and then you've got the slides. You've even got the participant handout, which is fillable online. It's digital, or you can print it. So that's all free to anyone. You don't need to hire somebody like me for it. You need to hire outside if you're doing a deeper dive into some of these things, but we try to make them bite size. So that everyone is only like an hour and a half to facilitate. Some of the psychosocial factor ones, they're meant to be a little longer because it's a team development exercise, right? It's a team building exercise around them. But the other thing I want to say to you is that what we're starting in 2021 is a learning management system where you can get continuing education credits, but these are very much individuals would sit down and finish a module and then get continuing education credits on it.
Right. And that's online? Is the idea?
It will next year.
Next year. Okay. So the other thing was, and because we've talked about this extensively before, is the pandemic has pushed things further, not only for like my mental health, but for my children's mental health. So are there resources, there's parents who are trying to hold it together so they look so that they're showcasing it to their kids, but then they don't know how to deal with this sort of bucket of it. Like there's just so many piles here. Is there resources for mental health for kids? So if I as a parent needed support, is there some place that I could go for those things?
For sure. So we partnered with the Psychology Foundation of Canada, and we started a resource called the 24/7 Parent. So there's lots of different articles and things there, but go to the Psychology Foundation of Canada, and their whole focus this year has been stress and anxiety for children. And they're doing a great job. They actually have a breakfast on November 5th. That if you go online and you find it, you can sign up for, where they're bringing in the top experts to talk about these things. And yeah,
that'd be good.
Yeah.
Psychology Foundation of Canada. So you can just head over to their website, and then I've been there before. They've got great resources, but 24/7 parent, that sounds basically what we're doing right now, right? That sounds exactly what I am doing.
Yeah, it is. You know, I was thinking back, you know, my boys are grown now, but when I was working full time and I'd come home and they're just bouncing off the walls. And what I would do is I would sit on the floor because I'm exhausted,
Yep.
But then they would think I was playing with them and they jump all around, and just being able to not fight with them about, I just need to do this, or I need to, just to let go, give them my full attention and not really have to do anything, took me out of my workspace and allowed me to transition to mom space. They felt good about it. I was able to actually relax. But what I think we tend to do as parents is think, okay, I'm home and I got to get supper ready and I got to get this done and I got to get that done. And the kids are just keep at you. And as soon as you slow down and pay 100% of attention to them, they can't sustain it for too long, because you're right there in their face and then they want to do something else. So spend 10 or 15 minutes sitting on the floor, letting your kids jump all around you before you get up to go and do something else.
So we're going to sort of wrap up. If there was, 1, 2, 3 final thoughts, final things that you had to share with, knowing that the audience is working mothers and lots of HR people, what would be your final thoughts?
I think that as we're going into our pandemic winter, that we really have to borrow from those people who live in dark, cold places, and what do they do? And I realize that one of the reasons that I have a hard time with winter is because I say, oh, I don't like the winter. I hate the cold. I don't want to, but I want to be on a beach. And that attitude actually makes it worse for me. And what they say is you have to see winter as a time where you're going to be cozy, you're going to relax, you're going to self-reflect, you're not going to push yourself, you're going to eat things that are nourishing, you're going to do things that are not rushed, are not hurried. And that's how they get through. That's how we need to get through. So I'm trying to do an attitude adjustment to get there.
Yep.
And hope everybody else can too.
Excellent. Any more final thoughts just on, working right now, HR people who are feeling stressed, trying to do all the best things for their employees?
Yeah, just to keep on getting the support from people like you, Allison, that we know that when we have our tribe, when we have people who are also going through what we are going through, when we share ideas, and maybe that's another activity for you, is to get everybody to share, what are you doing that works?
Right.
That's how we're going to get through it. That yes, we can't be face to face, but we can be in this together. We can help each other.
Great. All right, everybody. So thank you, Marianne. That was wonderful. We're going to be sharing this shortly. And I'm going to be making a list of resources so that if anybody's looking for these websites, I'm going to put them all down there. Yes, Canada Life Centre for Mental Health is an amazing resource, and Psychology Foundation of Canada. So thank you so much for taking the time to be here. Yeah. And have a wonderful afternoon.
Thanks, Allison. Take care. Bye.